Hey Prue, welcome to our first Q&A live. How are you going?
I'm good, thank you. How are you?
Good. For those that are watching, please excuse any of our internet disturbances, but we'll do our best today. My name is Natalie. I'm the founder and the director of the Paramedic movement, and we wanted to bring to you this live Q&A to introduce you to our fellow paramedic license providers. So we have a large network of providers around Australia, and knowing that you're not having access to other forms of education, we wanted to make sure, if anything, that you would have able to have access to some live Q&A. So these workshops are very specific to a question that you've come to with us, and our license provider will then provide an answer for you. So I'd like to take the opportunity to introduce you to Prudence Fletcher. She's our license provider in Geelong. She's been one of our baby and child first aid providers for, nearly two and a half years now. She's an emergency nurse, critical care trained, immunisation nurse. I know you do chronic health planning as well. You're a mum of two children. I'll allow you to introduce yourself briefly and we'll get cracking on some of the 5 top main questions that's been asked by parents.
Thanks, Nat. Yeah, so like Nat said, I am a registered nurse. I've worked for the last over 10 years now in the local emergency department here in Geelong. So lots and lots of, seen lots and lots of parents come through, and that's part of the reason why I did actually jump on board in the first place 2.5 years ago with Paramedic. After seeing so many parents and their concerns and their general worry about their child, whether they be actually a well child or whether they be, I didn't really want to come to the emergency department and have actually left it too long and their child is really unwell. So hopefully the whole point of these sessions is to give you guys a little bit of help and assistance just to ease some of that concern, because obviously going to the emergency department at any time is a stressful situation. So knowing when and how is the best place to seek help. Hopefully these sessions will be able to give you a little bit of a help with that.
Yeah, and I'm really excited about these Q&A sessions. So please feel free to put anything in the chat. If you have any questions that maybe we can answer in our different sessions, we plan on doing these on a regular basis, and our educators are volunteering for it. So thank you, Prue. As a parent myself, yeah, going to ED is really stressful. And I think sometimes when we attend baby and child first aid sessions or other types of education, we can miss some of those basic questions. And that's why I love today. Today is really identifying when to seek help when your baby has a cold. Now, it sounds really, really basic, and I'll let you answer some question, Prue. But I just wanted to, one of the things that really I find I didn't know myself until I learnt the fact is babies can't breathe through their mouth to begin with. So if they have a really snotty nose, like us with a cold, it's not a big deal. But for them, they're unlikely to go, oh, my nose is really blocked, and go and breathe. So they're continually, and I'm going to snort live, but they continually go trying to breathe through their nose.
Yeah.
Can affect their feeding, and it can seem to affect their breathing. Let's get cracking. So we're talking about how do you know if it's more serious than just a cold with your baby? And one of the first questions, Prue, we had is, what are the normal and abnormal breathing noises for a baby? So I just mentioned that babies can't breathe through their mouth, which means they're going to sound sort of snotty throughout their nose. They naturally have more fluids within their system that they're trying to excrete after birth. So how the hell do I know what is normal for a baby or what's not?
Yeah, so absolutely. So if you have had young children trying to sleep in your bedroom, so obviously safe sleeping guidelines are co-sleeping for that at least first 6 months. If you actually have had that baby in your room, they are really noisy. Babies sound like little piglets. They snort, they grunt, and that's completely normal. They are really, really noisy. But that can be quite concerning for a lot of parents, because they think, I'm going to bring this little baby home, it's going to sleep, it's not going to make any noises other than crying. And they get their first night, and it's all of a sudden it's snorting and it's spluttering, and that's normal for a baby. Like you said, they've got excess secretions when they are first born. Those do clear within the first couple of days usually, but they still remain quite noisy when they do sleep. And even as they do get a little bit older, they will still have some little snoring type noises or grunting, all that sort of stuff, until they're sort of around about that.
Which obviously gets worse when it's cold. So you know, how do I know it's more like, what am I looking for? Tell me, what are your top points? What would you look at for if you had a baby present?
Biggest thing that I want parents to really consider is not so much the noises. So yes, they will be grunty and they will be snorty and that. Strip off their top half. Have a look at their chest. So if you're worried about the noises that they are making, have a look at their chest. Have a look at what is happening there. And I will talk a little bit more about that a little bit later through this, because I know one of our other questions actually addresses this a bit more. But the biggest thing is, if you are concerned about the noises that they are making, have a look at what their chest is actually doing, because that will be your best indicator of how hard they are actually working or whether they are having any difficulties. And like you spoke about before, babies up to the age of 6 months are predominantly nose breathers. So any sort of congestion that they have from a cold or from bronchiolitis or anything like that is going to make them work really hard. So they will still have those snorty and grunty noises, but they will also have that worker breathing. So noises on their own can usually be pretty harmless. It's when we start to look at that chest and look at how they are actually working that they do actually become a more of a concerning feature. One noise in particular that I do want parents to really be aware of, and it's often mostly associated with croup. Now, croup is a viral illness, like things like bronchiolitis, the flu. They are generally viral illnesses. Viral illnesses, unfortunately, there's not a great deal we can do to actually help them. Unlike bacterial illnesses where we can give antibiotics to help shorten the duration, viral illnesses do just need to run their course. Often there are things like steroids, spacers, puffers, those sort of things that we can give to help with the symptomatic treatment, but don't actually help with the actual virus itself. So it just needs to run its course. But with croup in particular, they will get a really barky, it's a really distinctive cough. It's often described as sounding like a seal barking. So with that cough, if they have just got that cough and nothing else and they are otherwise okay, perfect. Keep an eye on them at home. You can ring your nurse on calls. You can see your GP if you need to, but generally they will not need any treatment. They will just need a period of observation. It usually takes 3 or 4 days to clear itself. When we get concerned with croup, when we get concerned with croup, is when they develop a stridor. Now, what we call a stridor is a whistling sound when they are breathing in, and that's a really important feature to actually take note of. It's when they're breathing in that they're making this whistling sound, not when they're breathing out. And it will sound similar to a when they're breathing. Sorry, that's going to make me cough now.
I know.
Does it every time during the sessions. So it's a real raspy, high-pitched sort of breathing sound that they do make. This is indicating that there is narrowing in their airways. So if they do wake, and it would generally be croup will hit in the middle of the night when nothing else except for emergency is open. So please do not hesitate. If you do hear that noise with that croupy cough, please call an ambulance and bring them into emergency. It's situations like this where they will need things like adrenaline through a nebulizer, which is just a medication to help open up the airways. To help them breathe easier.
You shared so much knowledge. And it's really, if you guys can't tell, we're educators. So we just want to keep going and going and going and going. But I just want to get it back to the question. So what are the normal and abnormal breathing noises for a baby? And what Prue was basically summarizing is, there's no abnormal or normal breathing noises really with a baby because they're so different. They're not like us that are peacefully going to sit there quietly, sleeping and resting. So I love to really just bring parents back to, especially if you're expecting, you will know what's normal and abnormal for your baby. And the one thing that I remember is with my own baby, I just sat and stared at them for every single minute of the day. And it's really good just to keep a diary, start making some indications of what kind of is normal for your baby, knowing that will change throughout the development period. Because the more you can understand that observation, the more you can go, hey, think this is abnormal. And that's really important. That identification process, which you're not going to get by looking online, is so valuable because you can just go, and medical experts, nurses and doctors will listen to a parent, I hope, most time, that says, just not right. My baby's just not right. And that statement is so powerful. And I see so many parents that just dismiss their confidence with that. They're like, oh, but I don't know. I'm not a doctor. I'm not a nurse, but just not normal. be really loudly spoken and confident when you say my baby is not breathing normally for what is normal for your baby is correct. The second thing Prudence brought up was croup. So croup is a viral condition, and when we said, okay, you can kind of know it's croup through a barking cough. Now the barking cough, you could just YouTube croup barking cough and you'll see some great videos. So just go make sure you have a listen to what the croup barking cough is, and then also the wheeze, which may occur, which is more an inhalation. And I'm not going to make you do it, Prue, again, but it's like this. And what I just want to point out, and Prue will go into more detail when we go through the next question, is when I breathe in. Okay, I've got a bit of a fatter neck, so this doesn't happen. It worked beautifully on you, Prue. But when you breathe in, this little bit gets sucked in, and that's what we're going to try and identify. So the next question, Prue, I will get up on our screen. I feel like we've gone through it, but we can do a summarize. What should I be looking for to indicate my baby has more than just a cold? So other than breathing, what about the color of snot? You know, we hear that so often. Is that true, or is it just because it's old and it's coming out later? What are some other things? I've heard runny poo can be an indication for a baby that maybe they've got something more than just a cold. So if you can identify maybe some.
Yeah, so biggest things to look for. So obviously we'll have your snotty nose. This impacts their feeding. So they're going to less likely want to feed. So in those situations, we want to make sure we're decreasing the amount that we're giving them, but increasing the frequency that we are giving. So smaller feeds more often to make sure that they aren't getting dehydrated, because a dehydrated bub is a very sick bub. Also, runny poos can be another one. Just their body's trying to fight off something, and that's just one way they try to eliminate things out of their body. That's going to be difficult with particularly your very young breastfed babies. Their poos are runny anyway. They're always running. So just, again, keeping an eye on what is normal for your baby. Is it that they're having more poo than normal? Is it that it's got a bit of an offensive smell to it? Things like that. The colour of their skin. So babies, when they do become a little bit dehydrated or they do become unwell, they become pale. If you ever have any concerns about your baby's lips, around their lips going blue, please seek medical attention ASAP. This is an indicator that their oxygen levels can be dropping off. So any blue around their lips, please see a doctor as soon as possible. Particularly if it is associated with any sort of worker breathing. But if it's not, even if it's not, if you're noticing that there is some change in colour around their lips, do always get it checked out. And the colour of their skin. So normally they'll be nice and pink, their normal sort of colour. If you are noticing that they are going really quite pale, you can do a little test on a baby by just putting a couple of fingers on the middle of their chest there and holding it for 3 seconds. There we are. So we hold it for 3 seconds there, take it off. You'll actually notice on my skin, I'll do it up a little bit higher so it's there. You'll actually notice the skin changes colour and then comes back to normal. So it should come back really quite quickly. If it's really slow to come back to normal colour, so if it's taking more than 3 seconds to come back, so more than the amount of time that you actually pressed on it, then please do seek medical attention as well. That can be an indicator that they can be dehydrated.
Right, and you know, maybe we should please comment below if you'd like us to do a Q&A on dehydration. I feel like this topic isn't spoken enough because I've taken my baby to hospital for dehydration, and that's when parents are like, do I give water? Do I give breast milk? Am I meant to give more? So we're not going to include it in today, but comment below if you'd love to see us do a Q&A on dehydration. Prue, before we move on to the next question, you said worker breathing. What does that mean?
Yeah.
But so for people that
are looking for breathing, that's right. So if you ever do come into a doctor's or into the hospital, you will hear us speak about the baby's work of breathing, and we'll refer to it as mild, moderate, or severe. Basically, this is just a classification for us to determine how unwell bub is. So basically, a child with mild work of breathing, you might notice that their breathing rate increases slightly higher than normal. So a breathing rate for a newborn baby can be as high as 50 or 60 breaths per minute. So they do breathe quite rapidly normally, and that is completely normal. Yes, Natalie.
Raise my hand. Would you recommend parents Googling what is the normal rate for babies and then trying to count the breathing of their babies, or just using what they normally think is normal and say that's a bit faster than normal?
Just using what they think is normal. Some babies will only breathe maybe at 40, others might breathe at 60, and that's completely normal individual. So like we were talking about before, you will get to know your own baby. Just know that a baby's breathing rate is higher than normal. So if you're looking at them going, they look like they're breathing a lot faster than they normally would, that's a red flag for there might be something going on. So that's only one factor though. So for a baby that has got a mild work of breathing, you'd otherwise imagine them to be normally well and alert. They may have, their cry will be relatively normal. And I will actually send out to all those participants that have registered, I actually have got a table that will outline mild, moderate and severe cases for you. So I will send that out with our email after this. And if anyone else would like it, please do get in contact because I can send that out.
Your email in the comments.
Yeah, we'll put my email in the comments. So if anyone else would like that fact sheet, I can send it out. But basically what we are looking for here is we are having a look at their chest. In a baby with mild work with breathing, you won't see a lot of change in their chest. You might just start to see their ribs as they're breathing. In a normal healthy baby, you generally do not see their ribs, particularly if they're a nice chubby fat little baby. You don't generally see the actual outline of their ribs when they're breathing normally. What you will notice is babies do breathe a lot more from their tummies than they do from their actual chest movements. So their chest wall muscles actually really immature. They use their diaphragm, which is the muscle that sits underneath our rib cage, to actually help contract and expand their lungs. So to do that, they use their tummy muscles. So you will notice quite often that their tummy muscles are going in and out while they're breathing rather than their chest actually moving. So a baby that's got mild work of breathing might start to get a little bit of that chest movement, but not too much. They're otherwise generally pretty active, and you just tend to find that their breathing rate goes a little bit higher. When we move on to a moderate work of breathing, you might find that their cry comes a little bit more intermittent. So they might still have quite a powerful cry, but then it'll sort of taper off to a weaker cry as they go. Or they might have periods where they aren't crying as much because they're actually focusing more on their breathing. You will find that these babies will start to have some intermittent issues with their feeding. So whether that is because they are congested, whether that is just because their body's trying to focus on breathing. So if you imagine you're just breathing through your nose, if it's congested and you're trying to drink, as an adult, when we drink, we breathe through our nose. So for a baby that's trying to drink and trying to breathe at the same time, when their nose is congested, it does get really quite difficult. So you will find that they will start to pull off the boob or the bottle quite frequently so that they can actually stop and take a few breaths. And you'll find that their breathing rate will actually go up after they have a feed because they've been working so hard to get that fluid in. They haven't been focusing on their breathing. They'll pull off, they'll take a few faster breaths and go back. Yes, Natalie?
Thank you. What would your suggestion be for me as an educator when we're going through breathing difficulties? I kind of say from top to bottom analysis. So what I mean by that, if they do have a snotty nose, try and clear that where possible before you try and make a determination of if there's something going on around here because of what you just said. So what's your thought on nasal aspirators? I love them. I think they're great to clear some of that nasal congestion. Again, it's something that I just don't see many people using or talked about. So would you mind from your nursing point of view, do you like them or don't? And as a parent, do you like them and you don't?
Absolutely, I love them. And then combined with just a simple saline nasal spray or nasal dropper. You can get them at pretty much any chemist. They are specifically designed for kids. So a combination of that, so that the saline will actually help to loosen up the mucus in that, or the snot in their nose, which makes it much easier to actually remove out. So if you can clear as much of that out, and guidelines as per the Royal Children's Hospital are to clear it out if you can.
Clear it out. And I loved it.
So much easier.
It was so much fun doing it. And I tell you, because they don't blow their nose, you can get big stringers like this coming out. And you do, they're going, wow, how was I expecting to feed you? So a fed baby is a happy baby. And this is exactly how that dehydration forms. All right, let's crunch on to our next question, which I feel like you've answered, but you might be able to provide some more assistance before you move on. Yep.
Yes. So when should I seek medical attention? So when baby's starting to get to that moderate work of breathing that we were just talking about, so they're starting to drop off and have difficulty with their feeds. You're noticing now that you're actually starting to see a more defined rib cage when they do breathe. You may be noticing, like we were talking about before, that they are starting to suck in here. So this is what we call a tracheal tug. So your trachea is your windpipe that goes down to your lungs. And so it will...
Yeah, yours works.
Like I was doing there. You may notice that they actually get flaring of their nostrils. Apologies, everyone. That looks quite funny, us pulling our things in. So flaring of their nostrils, when they take a deep breath in, you'll notice that their nostrils do actually flare out. So these are signs that they are starting to work a bit harder. They may start to become more irritable because they are unwell. Bubs that are unwell will be irritable. That's just part and parcel of it all. So if you are starting to notice that, please do at least make contact with your GP. If they are getting to the point where we now consider they may have severe worker breathing, you will now notice that your irritable bub has gone to now becoming quite flat, and not so much, they'll still be crying, but their cry will be really weak. They'll be quite miserable. They won't be interested in feeding at all, so they won't want to latch. They'll just push the bottle out of their mouth. They won't be interested. Their body is purely just focusing on trying to get that oxygen in. So if they are getting to this point, this is when you now need to call an ambulance and come to the emergency department straight away. Please don't hesitate if you are at that moderate point of breathing where they're starting to really start to look unwell. If you cannot get into your GP, please don't hesitate to come to the hospital. We are more than happy to see you. But do know that babies that do get to that severe point will obviously be prioritised higher. There is a triage system when you do come to an emergency department, so sicker people do get seen sooner. We do try and prioritise kids to their own little area where we can, but availability and demand on the service will indicate that. But the biggest things to look for are that chest wall. So once bub is getting to a severe point, you will see a defined out. You will be able to see their rib cage when they breathe. They will suck in between each rib. They will suck in our clavicles here, in that little tracheal notch there. They will suck in underneath where that diaphragm sits, so underneath the rib cage. You'll notice too that when they are breathing, when they take a big breath in, their tummies will suck in. When they breathe out, their tummies will go out. So they will do this back and forward sort of movement as they breathe. If they are getting to that point, they are working really, really hard to breathe. So this is a point where don't bother with your GP. Please come straight to the emergency department. GPs will take one look at you and send you straight on into us. Do not hesitate to call an ambulance at this point.
And I think, most importantly, and I just remember this so vividly as a parent that, and by the way, if you're watching this and loving this, can you share this with your friends? Like, the more engagement we get, the more popular we feel and the more we want to do it. So please, if you're loving this, comment, share, tag people, get everyone involved. Sorry, excuse me. As a parent, I was so sleep deprived, and I think, the minute my baby was sleeping or quiet, I'd never want to disturb them, right? And I think I was hesitant to remove those clothes, especially if it's winter and it's cold. And we all know that you change your baby a million times a day as it is. And you're like, oh, do I have to? Like, that is literally the most important thing that you can do is, sorry, excuse me, take the time to actually look. And often...
And actually take... And not just lift up and have a quick look, actually take it off. If you are concerned about their breathing, please take it off and actually have a proper look for a good minute, just observing that breathing. You can then put the clothes back on, but anytime you are concerned about any sort of change in their breathing, take it off again and actually have a good proper look at their chest. Yeah. That is going to be your biggest indicator for when they are, or how unwell they actually are.
And the last thing before we move on to the next question, wow, this is jam-packed full of content. I love it. Is that there is telehealth services available. We personally love Medinet. I'll do a little shout out. It's a service where you can contact a GP and they do a video call. I think this is really important. There's many different telehealth services available, and the reason we love Medinet, it's a video call. So if you're really stuck, and we all get stuck, don't we, Prue? I'm a nurse, you're a nurse, and when our kids are sick, we're like, what do you think? Like, you're automatically going to go, what, mom, friends, tell me, everyone. If you're a bit stuck and that decision-making process is just overwhelming, jump on a call with the doctor and say, look, what do you think? Yeah. That's the first tip. My second tip is film it. Film what you see, because so often a parent might go to GP or ED and they're like, oh, it was happening before. I swear, it was happening before I got in here. Film the
I
thing
can
and share it.
the amount of parents that come through to ED with a child that has been flat, floppy, miserable, as soon as they walk into ED, it's a new environment.
Yeah,
there's
alert.
new things to look at. They perk up and they go, ooh, toys over there. I want to play with them. And the parents sitting there at triage going, oh my God, if they were like this at home, I would not have come in. Trust me, we believe you. We know exactly what they do when they come in. Every child, we actually get worried if a child doesn't do that. So if your child comes in and they are still flat and floppy, we get really worried.
That's really bad. All right, good. Let's move on to the next question. How can I help my baby at home when they are unwell with breathing issues?
Yeah, absolutely. So like we spoke about before, nasal aspirators, saline nasal spray, or drops. They can be your best friend. They last for ages. Chuck them in the first aid kit. Just have them there. They are really good. Other things you can use, vaporizers. And this is, a lot of people are a bit,
I was about to say.
it's another sort of thing where it's, and look, I found personally for my kids, they are fantastic. I found personally for myself when I was pregnant, I was so congested when I was pregnant. Having the vaporizer in my room actually helped me sleep so much better. So vaporizer I personally will recommend. Some people will say, nah. Just make sure if you are using a vaporizer that you do actually open a window during the day to actually air the room out so that it's not building up moisture.
I do believe that the Royal Children's Hospital doesn't recommend it. And I just want to take this moment to say we are parents, but we're also educators and we are, medical professionals. It isn't recommended because of the safety issues around having hot water and steam, right? So if your kid's walking around, then obviously you don't want to put in their hands. So look, I personally love vaporize, and I think they say the same thing about any ointments that you put on and stuff. I love it as a mum. And this is where, I just want to share, we are parents, and that's why we love sharing this content to you, but you have to make that informed decision. So it isn't recommended because of the safety issues, but if you can feel that you can eliminate those safety issues and you love it as a personal choice, then go for it. So I just wanted to pop in and say that.
And that's exactly right. Like, we have ours sitting up on top of the dresser, so it's well out of reach of the kids. The cords are behind the dresser, so they can't actually get to it. So therefore we've eliminated that safety risk of having it down on the floor or somewhere like that where they could actually potentially touch or tip the vaporizer. It only runs once my daughter's in her cot, so she can't actually get out of her cot to touch it, and it's turned off and put away well out of reach once she is out of the cot. So again, weighing up that safety risk. Some people will find that they don't like them, full stop, and that's fine. It is each to their own, and you will work out with your child what helps. I personally found it an absolute lifesaver for my kids. So the other thing I do want to mention, because I do see it a lot, is parents recommending that when your baby has any sort of congestion, is putting some sort of wedge in the cot. Please, please, please do not do this to elevate baby while they are sleeping. It is a SIDS risk. And I do see it so often recommended in parent groups and those sort of things. Elevating baby when they're sleeping is not actually really gonna do anything. If anything, use your nasal aspirator, use your saline spray to help clear them up. Bubs are great at actually controlling their own airways. They are better slept on their back for a whole myriad of safety reasons, and I'm not going to have time to go through all of that today. But hey, if you wanted a safe sleep thing, let us know, because we can do that one as well.
Yeah. Well, what I love about Safe Sleep, just interrupting, is we really come from the viewpoint that we'll share the recommendations with you, but we always empower you as a parent to make that informed decision. And, I had reflux, baby, so you're right. I'm not going to lie. At the time, 10 years ago, I did put a wedge in there. Talking about any of that stuff, we want to give you the solutions that are recommended, and we'd love for you to direct you to do those ones first. And I think that's where we get a little bit stuck as a parent, because we get 50 things thrown at us saying this helps, this helps, this helps, this helps, that we don't know which one. So what we aim to do with our education is really identifying, well, these are the stuff that's actually recommended. Give them a good whirl before you start exploring alternative options. All right, are we happy to go for the next question?
Yes.
Yes. Okay. I would love to learn more. Can you tell me about your baby first aid online course?
I can. So we have just released our Baby Online First Aid course. So it's 2 hours worth of our online content, which features the very lovely Natalie presenting our topics there. It is $49.95 value, and you can actually support your local educators like myself, because obviously at this time we are not able to do our face-to-face sessions, so that is a big income downer for us. So you can actually support your local educator and support the Paramedic movement at the same time by purchasing this product. So it gives you your online content. It gives you a link to help you set up Medinet and to get yourself all set up there. And we recommend doing that while Bub is well. So get yourself set up so that if you are in a situation where Bub does become unwell, you're already set up. You're not then stressing, going, oh my God, how do I actually set this up? And I want to see a doctor over the camera, not just on the phone, because a lot of GPs at the moment have moved to a telehealth model where they are just using the phone.
Yeah. Which is
they don't have
everyone.
And that absolutely, that works for a lot of things, but particularly with breathing issues, you want to be able to see that doctor. You want the doctor to be able to see your baby's chest and see exactly what's going on. So it is a really great feature having that camera and that video function. That you can actually have that access to as well. So it gives you all the steps of how to actually set that up whilst your baby is well, so that you are not then in a panic if Bub does become unwell. Yes, and so you put your hand up there.
I know, I don't know how else to do it, because I can hear if I interrupt, it causes internet chaos. So if you guys are seeing me raise my hand, that's why. If we are recording this, so if you are watching this recording, we have paused all face-to-face sessions due to COVID-19. If we can't reassure your safety or ours, we've decided to develop the online product. The online product I'm really excited about. It is $49.95 per family. So, most times when you purchase something online, they're like, do not share this. And we're like, share it with your grandparents, let everyone know. It is newborn basics. What we identified is we can't just translate our face-to-face session. As you can see, the interaction, what's occurring now is where you learn. We can't really take that and just slop it into an online course. We don't recommend all of that happening. It's a complimentary online program for expectant parents or new parents. We've really focused just on the top things to why you might go to ED. There's so much learning to happen. And when you do purchase directly off your local educator, you're supporting them, because at the end of all this, we want to go back to running those face-to-face sessions. It doesn't mean the online course isn't bad. It isn't great. It's amazing. And the purpose of the course really is guiding you from my child's unwell to what I need to do. And we want you to get everything set up in place while they're well. So that is, I need to have the education. We've got the Paramedic triage tool, which is a messenger service, and you'll learn how to use it, where we've developed, and Prudence had great input on this, where we'll ask you questions, and based on your answers, you'll know whether to see GP or not see GP. And then we guide you to setting up Medinet. So when you are using that tool and prompted to see a GP, that you'll be able to make that call straight away. And then obviously what it looks like going to ED. And then we hope after you do that you organise an in-person event with us. It's going to be really scary for parents at the moment, because so many online services are in your face. We've been part of digital technology for a couple of years now, so it wasn't just a quick solution. And I'm not going to go ranting or raving. You can see I love it, but it's a great product. Please, it's in our Facebook shop. Please do share it with your family and friends or any expectant parents. Also a great gift. So moving on briefly, we do in-person events. So Prue, can you tell me about your in-person private and public events?
Yeah, absolutely. So we do face-to-face training. They are 2-hour sessions where we cover off topics including baby and child CPR, choking, fever management, febrile convulsions, allergies, anaphylaxis, burns, head injuries, poisons, and general safety for babies. So lots and lots of information. It's a big, full-packed 2-hour session, but all our sessions are designed to be 100% baby and child friendly. So no need to find a babysitter. We come to you with our private sessions, so you can have them at home in your living room. You can have them at a maternal and child health centre, or wherever you and your mother's group or family or whatever would normally catch up. They are great for like I said, mothers groups. Great for grandparents. I've had so many grandparents do sessions that absolutely love it. So much has changed since they had their own kids. So just to have that refresher. They are information only sessions. So there is no tests. There is no expectation at the end of this. We are going to quiz you on everything you ever learned today. They are purely information only, take home information. We do have handouts with the content in it that you get to take home. So there is ongoing stuff, and you do have contact with your Paramedic educator as an ongoing thing as well for future questions and that sort of stuff. And so our public formats are public formats are larger groups. So we organise a date and a venue, and they tend to be sort of more 20, 25 people in them. So yeah, sorry, Nat.
That's okay. All the educators in the paramedic movement have to complete an online course to become an educator. And there's a real focus on delivering this, what can be known as a very strict topic in a very compassionate and loving way. And we aim to be there throughout your whole journey. So what you might need to learn at 6 months will be different when your child's walking around. So we really just want to create those relationships. So, if something comes up, like maybe it is summer and you just learned about secondary drowning and that wasn't covered or you forgot it, that you can organise another session with your local educator. So next question. Can you share why you love to be a paramedic educator? We're always looking for more educators, and now is a great time to complete our course to become an educator. Would you mind just sharing what you love about being a paramedic educator?
Yeah, so I spoke earlier about why I actually became a paramedic educator in the first place after seeing so many parents just with that concern and not actually knowing why or where is the best place to seek that help. And what I absolutely love about being a paramedic educator is being able to go into people's homes or going to see these mothers groups, or that they're quite often first-time parents, but not always. Sometimes second, third, fourth children that they're thinking, I'm meaning to do this for ages. But just seeing them walk out of there going, oh my God, I feel okay. Yes, I'm still scared. Yes, if they do choke, I still feel like I'm going to panic, but at least I know now what to do and I know what to look for. And our courses are not just first aid. They're really about identifying those red flags as to what actually indicates an unwell child and what to do about it. So it's not just this is what happens and this is what you do. It's really about this is what you need to look for. And if you notice these things, this is what you need to do. Whereas if you notice these things, this is what you need to do. So it's really helping you to identify what those red flags are and where is the best place and when is the best time to actually seek medical attention, as well as being able to know what to do in an emergency situation before paramedics or while you're waiting for paramedics to get there. So you're not sitting there helpless. And just, seeing parents' faces as they actually leave or actually learning information going, oh, I didn't know that, but that's really cool. It's such a great feeling to actually be able to leave a session knowing that you have actually eased some of those anxieties.
Yeah, and it is a really, I love the word red flags because, too often I see a focus on teaching symptoms and names, and people are trying to look up the name of a rash. At the end of the day, maybe you did, but the majority of us didn't do a medical degree or didn't. We just want to know what to look out for and what that visually looks like rather than trying to put labels on everything. And exactly the reason, Prue, is why I started the organisation. I had one mum came to me, baby turning blue multiple times. She didn't have anyone who could teach her that was affordable and accessible. I think that's our mission, is everyone gets access, hence the reason we try and deliver information in different ways, our Q&A, our online, in person. That feeling of helplessness, no parent deserves to go through. It doesn't matter what socioeconomic background you come from, what degree you have, no parent deserves to stare at their sick child and not know what to do. It is horrible, and the amount of guilt that we hear from parents that they may have experienced because they didn't know what to do and they panic at the time, all that stuff's normal, but we just want to give you that gift. And I didn't have this knowledge until I did my nursing degree. No one else in my family came from a medical background, and whilst I was doing my degree, I was like, oh my God, everyone needs to know something about this stuff. So thank you for sharing your experience.
Yeah, absolutely.
I've got one more. How do I become a paramedic educator?
Yeah, so head to www.parentmedic.co. and check out our website. So here you'll be able to find the link to our online baby and child first aid course, but it'll also have a link to becoming a licensed educator. So if you click that and follow through, you'll get through to the lovely Tegan, who is our recruitment expert, who will be able to answer any questions. Otherwise, feel free to contact me. I'm more than happy to answer questions that people do have. If you are sort of in that sort of 2 minds where, I know, but I am, I am.
Yeah.
I am more than happy to answer any questions that people do have. And a lot of our educators will be more than happy to answer. But Tegan is the expert when it comes to everything recruitment related. So head to www.paramedic.co and that will follow the links to becoming a licensed educator.
Super. One last reminder, if people want to learn online, Prue, and we want them, you volunteer your time to do this Q&A, so we'd love people to purchase directly off you. You can always purchase it from our site, but we really want to support our local educators. And what happens, Prue has a secret link, and when she shares her link, it enables her to earn an income. And we say this with honesty and transparency because we're all in the same place. Prue, if people want to contact you to purchase an online product, how do they get hold of you?
Yeah, so for anyone who has registered for today's session, I will be sending out an email this afternoon that will include that link. So you will automatically get that link in the in this email, along with that fact sheet that I was speaking about earlier. For anyone who hasn't registered, we will put my email in the comments that you can contact me directly and I can provide that for you. Otherwise, if you do go to that website, www.paramedic.co that I spoke about before, and follow the prompts to our online baby and child first aid, down the very bottom, you will see a lovely little picture of myself. So if you do click on that, that will take you directly through for myself as well.
Wonderful. Thank you, Prue. I am just going to go through some of the questions that we had. We had some wonderful questions from, we've got a question from Jane. From a pediatric nurse point of view, what are your thoughts on saline nasal drops? I don't think they help a lot. Now, I know we went through this, so we love them personally. You love them personally, but everyone just has a different experience.
And look, some people won't. Some people will find that they won't help. I find that they really do help in just loosening up that mucus, so it does make it easier to remove with a nasal aspirator. But not in all situations. In some situations where they are just completely congested and it's much further back. So if you actually think about our nasal cavity actually goes all through our sinuses underneath our eyes here. So they may be congested here and not actually right in the nose. So it's not going to help a lot if that congestion is all here. But if they are really quite snotted up in the nose, it will. I do find personally that saline nasal drops and sprays do actually help.
So do I. And look, what's the harm in trying? Jane had another question. You didn't mention head bobbing.
Head bobbing. No, yes. So so part of when they're sort of doing that work of breathing where their tummy and their thing, you will notice that their head will be doing that bobbing as well. So that is another, thank you for that. I did forget that one, but that is another sign that they are working really hard to breathe. So their head is just doing that bobbing sort of sensation as they're breathing.
Yeah. And I think, that in regards to head bobbing, I mean, and we don't often mention head bobbing. It's probably because when they're breathing, they're going to naturally, your head is bobbing. But if you're not getting the abdomen in and out and inside the ribs and they're just bobbing their head, that's not really a sign of difficulty of breathing. It's when they've got the whole chest cavity moving in their abdomen, not just them bobbing their head on their own, because that's probably not very relevant.
Look, they may not necessarily be really doing that full work, but if they have got even that moderate work of breathing where you're starting to see that outline, their head's just starting to do this, and it might only be a slight bob, but you might see that head bobbing. That is signs that they are starting to work quite hard.
Got a few more questions. Annie said, absolutely film it, coming from a mum who had child croup 13 times last year. Yeah, it's and really importantly, if you want us to do a Q&A or croup, we can do it. What I love to share about people is croup itself is not dangerous, okay? I can get croup and might be okay. It is what happens with croup. And when croup's associated with breathing difficulties, That's the issue. And that's where I really try and get you guys take a step back from a diagnosis and just go breathing problem, not breathing problem. It doesn't matter what it's caused from. So people get really, really scared about the word croup, and shouldn't every child go to hospital with croup? And why isn't my child going to hospital? Because we don't really, we used to just admit every child that was diagnosed croup, and why doesn't that happen now? And that can, again, have so much fear because you're wondering why you're managing this at home.
And the new guidelines actually with croup, if they don't have that stridor, that noisy, that whistling sound when they breathe in noise, they may not even get a dose of steroids to help. If they have just purely got the cough, a lot of the time they won't even give any treatment. They will just let it run its course. So if it is just the cough and they've got no other breathing issues and they are otherwise happy, yes, it will be terrifying because it will generally wake you up in the middle of the night. Because that's when it hits, when nothing else is open except for emergency. Generally, if they are otherwise fine and you can keep them calm, by all means, leave them at home. You can get them checked by the GP the next morning if you're still concerned, but it would just be a matter of let it run its course. If they do have any sort of increased work of breathing that we did speak of, or if they do have that stridor, please come into emergency.
Yeah, it can be really scary, but we know a lot of parents get sent home now and they're like, why would I be getting sent home if my child has croup? So if you do want that, mention it in the comments. And if people are watching, you do have more questions, we're going through them now. We've got 2 more. Tanya said, thank you. Our pleasure. And one more, thanks, Prue and Nat. Really valuable stuff. Would love a session on dehydration. I love dehydration. Bring it on. And that's our last question. So, or comment, and I think we'll tie it up here. Prue, any last comments on your end?
No, just really making sure that if you are concerned about their breathing, biggest thing that I can say, like we were talking about before, is please strip off their top half and have a look at what their chest is doing. That is the most important thing when it does come to breathing. That will indicate how severe they actually are. And if you do notice any change of color, particularly in their lips, that bluish color, please do get them checked out by at least a GP. But please, your bub's the best. If there is something that is just not normal or not right, then please do make sure you do get it checked out.
Wonderful. Thank you so much, Prue, for your time, and thank you for everyone else that's watched our live Q&A. We've done 46 minutes. That's nearly half a real course. How lucky. But, this is a wonderful opportunity because we're covering so much in a course that we can really kind of dive deep. I've thoroughly enjoyed it. I hope you have, Prue, and I hope everyone watching does. And, we've got one more question. Let's go there, Prue. You're happy to go there? I'm happy to go there. Tanya asks, what is your gagging on mucus during a nappy change? I like this because often, isn't it that people think you do first aid for choking, but if it's for mucus, you're not meant to. Prue, take it away.
No, so just bringing them into that upright position. So if they are really snotty and really mucusy, bringing them up into that upright position. Yes, they won't have a nappy on, so they will probably be on you. Perks of being a parent. But if you're really finding that they are having really bad mucus, those sort of things, obviously nappy changes can be done in an upright position if you really need to. It usually takes 2 people because it can be quite difficult, but if you need to do it in that upright position, see how you go. Otherwise, trying to clear as much of that congestion with the nasal aspirate or with saline drops just prior to doing your nappy change. So just preempting that, okay, I know they've been snotty, I'm going to have to do a nappy change soon. Getting in, giving them a good suck with that the nasal aspirator and the saline drops or spray before that nappy change.
Yep, and sorry for the noise, guys, in the background if you can hear it. I do have my kids home and meant to be homeschooling. So apologies if you're hearing a bunch of squeaky doors and people walking around. Okay, so I just wanted to make note that if you are gagging, if the baby's gagging, not to do any choking first aid. That's not recommended. The second thing is, and thank you, Tanya, that's our pleasure. If anyone else has got questions, throw them in. The second thing is, I know sometimes it might be recommendations of a physio, or it might be an old school recommendation to put your baby over your lap on an angle and give a massage or cupping. I did it, to be honest, because it was recommended by my physio. We're not physios, so we're probably not going to go there. But Prue, is there anything that parents should be concerned with advice like that? Where should they go to seek that advice, or is there anything like, how do they know that's the right or wrong thing to do?
Again, going on individual. So speaking to your GP, if you do have a physio or something like, or an osteo or someone that you do see regularly, and that are your recommendations, then follow those recommendations. These guys know what they are doing.
Yeah.
If you are, I do recommend though, if you are seeing a physio or osteo, do see someone that is au fait with babies. So a lot of physios don't see a lot of babies. There are specific osteos out there who just specialize in infants and children. So please do try and track down someone like that, because they will have the most up to date, and they are the best source for those recommendations.
Now, I think that is it. I'm not getting any other questions through. And I love what we've covered today. So thank you, Prue, so much. I know you volunteered your time to be here. I'm currently homeschooling during COVID-19. You're doing the same, and lots of ED shifts. So really, really grateful. Thank you for coming to our live session. If you love this, comment. If you want us to cover another topic, do so. We'll be promoting all our live events in events Facebook tab. And hopefully I get to see you guys register for an online course. I'd love to see your names there. Once you're in the online course, you have an option of throwing in Q&A all the time. And that way we use your topics that you've submitted in the online course to build our Q&A. So thank you guys, and thank you, Prue.
No worries. Thanks, Nat. Bye.